Welcome back to Professional Perspectives. I'm your host Praneeth Vemori, here with my co-host Ara Vakela. We're so excited to kick off Season 2 of our podcast. If you tuned in last time, you heard an insightful conversation with Blair Ballin, a Phoenix-based realtor who shared valuable lessons about building a career in real estate and fostering community. Today, we're taking a deep dive into the world of healthcare and dentistry.
That's right, Praneeth. We're thrilled to welcome Dr. Chung, a dedicated dentist and leader in the dental community, for our opener of Season 2. Dr. Chung completed his bachelor's degree in biochemistry at UCSD and earned his Doctor of Dental Surgery, or D.D.S, from UCF. He's passionate about providing comfortable and personalized care for his patients and staying on the cutting edge of modern-day techniques.
Dr. Chung has taken extensive training in dental implants, dental extractions, tissue and bone regeneration, and gum treatment. Outside of dentistry, he enjoys playing basketball, writing music, and hiking with his wife. We're excited to hear about his journey, his passion for continuous education, and his advice for students interested in pursuing healthcare careers. Dr. Chung, welcome to Professional Perspectives. It's an honor to have you here.
Thank you so much, guys. It's a pleasure to meet you, Praneeth and RV. It's a real pleasure that you guys invited me. It's also amazing that you guys are doing this at such a young age. I mean, things have changed since I went to high school. I actually went to high school around here in the Bay Area. And podcast wasn't a thing. So it's amazing that you guys are doing this now, so I'm glad to be here.
Amazing. So, Dr. Chung, what initially drew you to dentistry, and how did you decide that it was the right career for you?
It really started when I went to college, actually. I went to Mission San Jose High School, which is out in Fremont. And I think my career path back then was, the typical career path for Asians, right? Engineering, either you're going to be a doctor or you're going to business. So usually one of those three options. So I actually started exploring dentistry in college when I went to UCSD. UCSD had a great pre-dental program. And, I really always been really thankful for going through that program. And that really kind of changed and broadened my perspective. So that's how I really got started on a journey. That's when I learned about what dentistry was about, and I also look at my old dentist, who inspired me to look into dentistry as well. I got an intern at his office, during high school. I got to shadow him. So that was also very helpful.
Yeah, so your journey actually began with a degree in biochemistry. And how did this foundation help you prepare for your dental school and your career?
It provided all the classes that you need to do to apply to dental school. I would say it's not a requirement that you need to have some sort of science or chemistry background, but it does help to get all the prereqs when you do have that. I would say it definitely helps broaden your understanding of what the body is, because when you actually go and when you actually study biology in dental school or medical school, a lot of it's applied science. So it takes concepts that you already have from your cell biology classes and group them up together to form, to have the next order, which is, how does this all connect and how does it help with understanding how the body works. So it did help in some aspects, but majority of stuff that you're really going to learn is when you actually go into the professional school, when you can link everything up together. I think there were some students even in my class that, they didn't study biology. I think they studied music or something in the arts. And something that the schools don't really teach you is that when you have something in the arts, you also have a much broader perspective, and it requires that. I mean, it's very nice to have when you have a broad perspective of interests in terms of relating to patients, understanding how people are, because the bottom line is that dentistry and medicine is very personal and people driven. It's like a people business, you know.
So, yeah, Dr. Chung, in the first question, you talked about how you shadowed your dentist in high
Mm-hmm.
school. Uh, for high school students right now interested in maybe dentistry or healthcare, what would you recommend that they should do?
I would say try to get as much involvement into dentistry. Um, one of the easiest way to get into an office is just to shadow somebody. That's how I got the opportunity to just shadow what a dentist does. Um, it really shows interest, and it's helpful because we oftentimes think that studying and getting into dental school is the toughest part of dentistry. Uh, you ask a lot of people who are in dentistry, they said, they have other things, right? It's the business part, it's the people part. The dentistry part is always that always gets better and it becomes easier. Um, so being in an office, there's really no replacement because you're in a setting where you get to visualize how other people, how dentistry actually is done. Um, and even for my office, we actually do a lot of training. We take a lot of people. We take a few interns every year that go into my office with no experience, and as long as they have the drive and they're willing to work hard, there's opportunities. Shadowing probably would be the start if you can get a dental assisting job or start um, get a dental assisting job. That would also be very helpful. I think one of the things that at UCSD that I got to do a lot was being able to volunteer as a dental assistant at the free clinic at UCSD. I'm giving a big shout out to my the UCSD Prudential Society. I mean, that was really, really big. So I got a lot of experience with dentistry. I got to see how dentists work, see how the office operates. Having that in-office experience is very invaluable if you can get the opportunity. So, and I think the people who come with being able to work hard and stay hungry, those are the ones that opportunities open up a lot.
Yeah, of course. And like you said, mentorship and networking had a huge role in your career. How could these students build these connections early on?
One of the things you guys could do is kind of look for opportunities like organized dentistry. They have regular meetings. You can meet dentists there. Um, I got in the habit of actually meeting people at the dental society back in UCSD. Um, you know, I was invited. We were able to get invited to the local dental society. There's also the Academy of General Dentistry, which I'm a part of. We love to have students come in and just kind of talk to us, especially if they're really interested in the profession. So those are great resources in terms of networking. And you're going to see uh, dentists, dentists and specialists from all over the field. So it really gives a really broad perspective. And another one that'd be easier accessible is probably just whoever's your dentist is. Ask them, hey, can I just show up in your office? Maybe on slower days, can I just kind of be around, and kind of see, and see what they do to let you. I mean, some dentists are going to say yes, some dentists are going to say no. Some people are a little bit more willing to train. Some rather have someone a little bit more experienced. So, yeah, I would say that's a good start. If you don't know, the other one would be the dental societies and organized dentistry, like Academy of General Dentistry.
So, you talked about running your own dental studio, and running a practice involves more than just patient care. What challenges have you faced in managing the business aspect of owning a dental studio?
Yeah, because now that's completely outside of dentistry. The business aspect is very different in terms of dentistry. Um, it's definitely a lot more of the people involved. You're working and you're working with a lot of different team members, um, and that's that's probably the most challenging part. When you work with team members, you're working with patients, um, um, really dealing with different personalities in the office and even among your patients. So it is a very different perspective, um, in terms of compared to dentistry. Because dentistry, it's you sit there, you do your work, and you're kind of done. But the business, it's constant. It's constant.
Yeah, and one of the main parts about this business is making sure that your patients feel comfortable, right?
Yeah.
So, what strategies would you say that you use to help patients feel at ease during their visits?
Um, Definitely being able to talk to them, and trying to understand them, like listening. Active listening is a very underutilized skill as well. Being able to listen to them, um, and really have sympathy for them as well. If you can kind of connect with them there, um, and also reassure them. I mean, a lot of the anxiety that people have around dentistry, they had a bad experience in the past, have some, we're able to show some sympathy around that. And, they are much more willing to kind of accept and be comfortable with the work. Um, More physical things would be, having gentle hands. We have pillows in our office, that if a patient, their neck positioning is a little awkward, give them that. We also give blankets if they're cold, or if they want to just kind of feel like, they want to be hugged by a blanket. All those things help. And we do also even have a stress ball. If we really need to grab onto something, uh, we try to hold them hands and try to make them feel as comfortable as possible. Sometimes even dimming the light or slowing stuff down.
It's great to hear that you have so much in just taking care for patients. Do you feel that in the upcoming years, as the dental field constantly evolves with new technologies and techniques, do you feel that technology can help you in your customer care experience?
I would say even in my short career as a dentist, technology has already made a big impact. When I started, when I started in dentistry, scanners was still getting a lot of adoption. Intraoral scanners, and now a lot of offices have that already. It's no longer, we hit the mass adoption for that type of technology maybe in the last 5 years. Almost every other office, have been using a lot more digital dentistry. So technology definitely is going to grow an increasingly um, vital role in how dentistry is done. Um, and it's even continuing to evolve. I know my office, when we started our office, um, we're looking at building for servers. And we actually found a solution where we don't even need to build a server. Everything's on the cloud for us. Our records are now in somewhere in Microsoft Azure, so we don't even have the local servers. So and it's very convenient for the staff to work, and even for us. So technology, it's really making a big impact. I think moving forward in the next 5 to 10 years, we're probably going to see a lot of AI influence. We're already seeing some AI influence in dentistry already. AI and robotics, I would say those two. There is actually a company out there that actually has a robot arm. Um, it's still very new. There's a few offices that have actually are testing it in the Bay Area. So it's definitely a lot of changes. It's still very early. It's probably not going to hit mass adoption for at least some time, but it is something that's down the pipeline. Um, and yeah, technology, can't say enough about it because we're really at the point where we're going to start to see a lot of technological changes as well, even within a field like ours.
Yeah, and this huge field that's constantly evolving, it can also sometimes overlap with other broader healthcare issues. How do you collaborate with these healthcare professionals?
Yeah, technology has helped. One of the things that we've also done in my office is actually we send electronic prescriptions. So a lot of times our communication with our colleagues in the pharmacy is just done electronically now. I don't think we carry too many prescription pads anymore because that's not so because it's just so much more convenient to just send the prescription. It's already there, or if there's any edits, they can probably also, request on the app, on our pharmacy app, and we can just make that change right there. So it does help a lot with the patient care, and that form of communication is also very easy. Um, but there are also challenges as well, because the healthcare information is a very protected. Um, it's a very protected information. People's healthcare information is very protected. Um, so, one of the biggest challenges to solve is, how can we share it among actual professionals and doctors without safely, without that information getting leaked. So that is still a challenge. Getting everything upright. Getting everything to be consistent from our medical colleagues and even among our colleagues ourselves. And I think the digital part, it really helps if we can kind of keep improving on the cybersecurity around the health information of the patients, and also um, having more people buy into the electronic communications.
Sure. So to backpedal into the early stage of your career, you went to Mission San Jose, which is clearly a very competitive high school. How would you say that that competitiveness in your high school helped shape your career, or not so much?
I would say it definitely helped. It's not a requirement. It's not a requirement. There are benefits from being in a competitive environment. You just kind of get used to the competitive environment. Um, but I would say, the common thread about, uh, people going to dental school. I'm looking even among my classes. Not everybody went to a competitive environment, even in high school. But that doesn't mean that you won't be challenged when you get to dental school. So I think it's more of developing your personality, developing that perseverance, from a young age. You can do that many ways. It doesn't even have to be academic. It could be from sports. You can get a lot of perseverance by doing sports like tennis, or you can learn teamwork skills and competing, by playing basketball. So those skills, are really what uh, it's going to help get you through those challenges. It's really how you respond when you hit a challenge. So mission was great, but that's not a requirement to be able to get to dental school. You know.
Yeah, and as well as being an executive board member of the Northern California Academy of General Dentistry, you're
Mm-hmm.
also involved in multiple other dental organizations. Has this leadership, what extent has this leadership impacted your career?
Oh, I think definitely being involved in organized dentistry has a sizable impact. Because a lot of times when you own your own office, you're by yourself, and you don't really know what's going on. Sometimes you might not be aware of what's going on, and when you kind of talk to other dentists, you have like other different perspective, or even shared problems you might have, and sometimes the solution is just talking to your friend, and they gave you a solution. It's like, oh yeah, I didn't think about that. So being part of organized dentistry, that really kind of helped resonate and kind of keep keep yourself in the loop with what's going on. Like even just this year, we had a pretty big change. We had a pretty big update on the dental board, dental practice act. Um, they're changing some of the roles that dental assistants can do. That would kind of help downstream in a lot of offices. Just being able to be involved with other people in the organization that are at the forefront of that, and hearing, what's the changes down the pipeline. Those keep you updated on what's to come in dentistry.
So, Dr. Chung, you just talked about the benefits of being in a dental community and being deeply involved in the dental community through your leadership roles. What advice do you have for students about giving back to like their community?
Um, I would say when you're part of the leadership, you really want to think about like organized leadership. You really want to think about um, who are your who are the people you're going to serve, and then what are their needs and what are their wants. Um, so when you're looking to have community making an impact on the community, that would probably be the first to go. The first few questions to ask yourself, what do you want to accomplish with 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 your team of students or team of people. Okay. Um, like for us, the Academy of General Dentistry, our main goal is really to help improve the education for general dentists. Um, so we're always thinking about what kind of classes do these dentists want, and finding the right talent and teachers to help us kind of learn more. Um, so really want to think about who and what you're trying to accomplish, and then from there you can figure out how you want to do it.
Of course, and managing all these roles in the dental community as well as managing your own firm has this can be very demanding, but what strategies do you use to stay motivated and avoid burnout?
um, Avoid burnout is, that's why I like to play sports. I play basketball. We have a league in which I get to um, play, and keeping that schedule really helps. um, I mean, from a young age, I also learned to work pretty hard and pretty long. So, I kind of enjoy what I do. So that's also part of it. Um, and kind of having and making everything, work well. I think that's fundamentally what a business owner should be thinking about, is how to make everything run smoother. How can we help more people? Um, and then how can we make the lives of the patients better? How can we make the lives of our employees better? We had that type of perspective, and things run more smoothly. um, it feels good. It feels really good. So when we're balancing all of that, when things are working well and running well, it feels, that's what really, that drives the business. So um, and so that's kind of how I approach it. And and also think of it like it's not so much of a sprint for a business like a dental office. It's more like a marathon. So we're trying to go the longest and farthest. And when we have that perspective, it's a lot easier to find the time to maybe take to control your energy throughout the whole marathon, rather than burning everything at once. Um, so I think that those two perspectives, helping as many people, helping even your staff, and um, having a kind of a long-term mindset that, hey, we're in this for a long time. you know um, it helps changes the perspective of, okay, when do I rest, when do I you know when do I take my breaks? So
So you talked about pacing kind of your balance and how you approach it, but balancing a busy career with personal interests
Hmm.
like basketball and music can be challenging, especially when you have your own firm and it's kind of like you're the boss and like you're the only one. So how do you like approach and maintain that balance?
I would say that it kind of evolved. It's not so much of a balance. It just kind of evolves, um, and what you want to do. Um, because I think like the different parts that I do, they each give me um, different purpose and different joys in life. And it's just kind of like switching one to another. So it's like um, yeah, it's kind of like just switching one to another. So it's not, it's fun when sometimes you want to break from one thing and then you just do another thing. So you always have that energy to kind of just keep doing stuff. Um, so that's kind of how we balance it. It's more of a balancing your interests rather than balancing your yeah and putting all your interest into your time.
Yeah,
It's,
and
yeah.
of course, your profession's also as enjoyable as your own life. So, what's one of the most rewarding aspects of your job, and why does this stand out to you?
Oh, that one's pretty easy. The most rewarding thing is when you actually see a patient and they're very happy with your work. You know, you made an impact in their life, and you can see that immediate impact. When they have that impact, there's no when you realize you changed their life really like for a long term. There's that is really what you're working for day to day. You know, like when you really change, yeah, there's no words to describe. You could just see it, their happiness. It's like, great, I did good. So I think when people you know feel that, hey, you know um, you did a really good job, this is amazing, I never even imagined that my I could look like this, or I could feel like this. That's awesome, right? Because you made a difference in their life. And um yeah, and that's really what drives you and that makes you happy, when people are really appreciative of what you do.
So, Dr. Chung, you talked about how your day-to-day motivation is seeing your patients and knowing that you did something good for them. What has been one of your most memorable experiences as a dentist? And you kind of talked about it, but like, how does it change your approach to patient care?
The most memorable, it would be actually just a case that just finished recently. Patient comes in, she's struggling with her dentures, and we treatment plan a overdenture for her, which is a denture with implants. Um, and I just remember when we first finally delivered the case, it's like, wow, this is this is this feels so much different. I can bite now. I have so much strength on these teeth. Uh, and just seeing her smile when she actually got those overdentures, it was very, very happy. Um, yeah, she was very appreciative of what we did, because she started sharing with her, I'm eating steak today, Dr. Chung. Haven't had steak for some years. So those are really nice moments.
And so, for students trying to go down this path, are there any programs that you did or resources, and including the mentorship and shadowing that you did?
Yeah, I would say the UCSD Pre-Dental Society is probably one of the best top programs you can get. And anybody can get in. You don't even actually need to go to UCSD to actually go. You're around the SD in that area. And you're interested in dentistry. You should definitely take a look. Um, yeah, just to put it in perspective, I think that program when I was there, um, there wasn't anybody I didn't know at a dental school I interviewed at. There was at least one person in that dental school. That's a lot of dental students were sent into dental school, out of that program. So it makes the interview process actually very comfortable. They already gave you a tour. You met up with them the day before your actual interview, and then you already got a tour, by one of your friends at the Pre-Dental Society. That was very helpful. It kind of puts your nerves at ease when you're actually going through the interview. So by the time you walk in the interview, you're a lot more relaxed than some of your other interviewees. And the type of experience that you got, by volunteering at the local at their health clinic, at the dental health clinic, and even traveling around the world, being a dental assistant, that was, I would say that adds a lot to your experience. Not just for the application, but even just for you as a person. You really get to see what dentistry is like in those environments. So I would say UCSD, Pre-Dental Society, big shout out. And then, one of the things I wish I did more as even a college student is maybe, learn how to get a job at the dental office. If you got all your certificates, becoming a dental assistant does not require you to have any sort of degree. You really just need to have all your certificates, and you can kind of go and do it. High school graduates it's totally fine, but you have to kind of know what to get the certificate. So you do some homework and you do that. That would be very invaluable, because any work experience where you actually are working and paid for working are going to really show you what that industry is going to be. So really, if you can get a work experience, that would be probably very helpful as well. Probably second to the Pre-Dental Society as well. If you're not in UCSD, right? So if you got that work experience, it does help. And, like I said, we all do offer even like the intern program, because we know that people are interested. And another thing in dentistry is that we're always educating. Either you're educating your patients, or you're educating we're teaching from each other. You're learning other dentists, or even just teaching and learning from our staff. So education has always been a big part of dentistry, of what we do on day to day.
So, Dr. Chung, for our final question, what's one key takeaway you'd like our listeners, to remember about pursuing a career in healthcare or dentistry?
I would say the biggest takeaway is that, go and shadow and get that experience to see if this is really for you. Volunteering at the hospital, I before dentistry, also, did dabbled into medicine as well. And I learned that, hey, if they work 12-hour shifts, I didn't want that. So I decided not to pursue that. So, those are things that you're only going to know by volunteering, and being part of, going to and meeting a lot of doctors, going to organized dentistry or organized medicine, talking to actual doctors, very invaluable. If you want to make some money while you're at school, go get a job at an office or a clinic. And then also if your colleges have a pre-dental society, you're gonna meet other like-minded college students that are trying to get into healthcare. With shared experience, you can learn a lot, and even just talking to those colleagues. So those are the kind of like the 4 ways that you can get involved and really learn about what dentistry is about, or healthcare is about.
Dr. Chung, thank you so much for joining us today and sharing your journey into dentistry. Your passion for patient care and education is truly inspiring.
It's been incredible to hear about your experiences and the advice you have for our students looking to make a difference in healthcare.
To our listeners, if you're considering a career in healthcare or just want to learn more about making a positive impact, Dr. Chung's story is a great example of combining passion with purpose. And don't forget to subscribe to Professional Perspectives for more inspiring conversations.
Stay tuned for our next episode as we continue exploring fascinating career paths. Thanks for listening, and we'll see you next time.
Take care and keep pursuing your professional perspectives.